There's a new warning tonight from officials at UW Health. RSV cases have more than tripled in Wisconsin compared to this time last year. In the first few weeks of October, more than 350 pediatric patients at UW Health Kids tested positive for RSV. Dr. Joshua Ross with American Family Children's Hospital and UW Health says kids had limited exposure to respiratory viruses during the pandemic. So many are getting sick for the first time as their bodies build their immune systems. He says it's important for parents to pay attention to how fast your child is breathing. If they're breathing between 60 to 80 times a minute and they have a fever that won't break, you'll want to take them to a doctor.
So my overall message is awareness that, there's a lot of viruses circulating and you want to keep your family safe, and especially knowing that our healthcare system is strained. That's a reality, but to not be afraid to seek care if their child needs it. And I would start that with a phone call. Start with your primary care doctor to better understand what are your options, because sometimes it can be other things you can do at home.
Dr. Ross does not recommend over-the-counter cough and cold medicines. He says those could actually cause more complications in children, but you can use acetaminophen or ibuprofen to help reduce fevers. Dr. Ross says humidifiers are also helpful, and it's important to keep your child hydrated.
Hospitals across the country are dealing with 3 respiratory illnesses at once. RSV, flu, and COVID are rising concerns about a possible triple-demic this winter. Pediatric hospital beds are almost at capacity in 5 states, with Rhode Island reaching 99%. Along with the rise in RSV cases, the flu is also a growing concern.
Among the children that we've been seeing with COVID and influenza that are requiring hospitalization, 95% have not been fully vaccinated.
The CDC says flu positivity rates are higher than usual for this time of year. While COVID cases remain relatively low, doctors worry about much of the impact all 3 of these respiratory illnesses will have this season.